For over 4,000 years, ancient cultures used ginger as medicine. They didn't know the name of the active compound. They didn't know the biological mechanism, but they knew it worked. Today, science confirms it. Gingerol, the substance found in this root, acts against tumors, protects the brain, stabilizes blood sugar, and much more. There is, however, a drug interaction that almost no one mentions, and I need you to know about it before this video ends. My name is Dr. Thomas Ellsworth. I dedicate my career to studying how foods and natural compounds influence long-term health, especially in mature adults. If you're not yet following this channel, subscribe now. Let's start at the beginning. What makes ginger so powerful is not the root itself. It's what it carries inside. Gingerol is the main active compound. It's responsible for the spicy flavor, the characteristic aroma, and most importantly, the antibacterial and antioxidant properties that make this spice far more than a culinary ingredient. When you heat ginger, gingerol transforms into another substance called shogol, equally potent. Both act together in your body in ways that conventional medicine was slow to recognize, but which today have solid scientific backing. The first effect I'll address is one of the most studied, nausea control. It sounds simple. But for those who face nausea for any reason, whether post-surgery chemotherapy treatment or simply a car ride, this property has real value. The practical recommendation is a tea made with 1 teaspoon of grated root in 1 cup of boiling water. Taken 2 to 3 times a day, it acts on the digestive system and the central nervous system at the same time, reducing the nausea signal before it intensifies. Have you ever used ginger for that? Share in the comments, because most people who know this learned it from someone at home, not from a doctor. The second effect is what I consider one of the most underestimated, strengthening the immune system. Gingerol stimulates the production of cells that researchers call natural killer cells. They are your body's first line of defense against viruses, bacteria, and even abnormal cells that could become tumors. Along with that, ginger also stimulates the production of white blood cells, which strengthen the immune response more broadly. In adults over 50, this defense function naturally begins to lose efficiency. Regular ginger consumption doesn't reverse aging, but it can measurably slow that decline. The third effect is directly linked to the digestive system. Many people live with that heavy stomach feeling, frequent heartburn, or slow digestion without knowing the cause may be excessive gastric acid production. Ginger regulates this process. It reduces excess acid production and speeds up gastric emptying, meaning food passes through the stomach faster and discomfort decreases. It can be consumed as tea, added directly to food, or even chewed in small pieces before meals. The effect is gradual but consistent. And speaking of consistency, that's the point that separates those who feel a difference from those who don't. It's not the heroic dose of one day. It's regular, moderate use day after day. The body responds to habits, not impulses. That applies to ginger, and it applies to practically everything involving preventive health. Still ahead are the effects on cancer, diabetes, Alzheimer's, asthma, and migraines. And there's something about contraindications I need to show you carefully, because depending on the medications you take, ginger may not be as harmless as it seems. Let's talk about cancer. I know it's a heavy word, but that's exactly why we can't ignore what science has already discovered about ginger in this field. A study published in the Journal of Cancer Prevention Research tested the effect of ginger extract on mice with breast cancer. The result was a 50% reduction in tumor growth. In addition, cancer cells lost part of their ability to spread to other tissues. This is what researchers call metastasis inhibition. It's not a cure, it's not a treatment, but it's evidence that cannot be dismissed. Another study specifically analyzed prostate cancer. The data suggested that consuming 3 grams of ginger powder per day can reduce the risk by up to 40%. This number comes from an in vitro study, meaning it was done in a laboratory with isolated cells, but it points in a clear direction. Gingerol interferes with the life cycle of cancer cells, blocking their multiplication, and in some cases inducing programmed cell death. Have you ever heard of these studies? Most people haven't, and that's exactly why this channel exists. Now, type 2 diabetes. This is a point of particular interest for those already dealing with insulin resistance or elevated glucose. A clinical study conducted in 2009 followed 16 healthy volunteers for 40 days. Half received 500 milligrams of ginger powder per day. The other half received a placebo. At the end, the group that consumed ginger showed better insulin sensitivity and lower blood glucose spikes after meals. This means the body became more efficient at using sugar, reducing the pancreas's workload, and decreasing the spikes that damage blood vessels over time. The impact on the brain is what impresses me most. Laboratory tests showed that ginger extract inhibited the production of a protein called beta amyloid by up to 80%. This protein is the main driver behind the formation of plaques that accumulate in the brains of Alzheimer's patients. These plaques disrupt communication between neurons. They don't appear suddenly. They form over years, silently, long before the first symptoms of memory loss. Ginger consumed regularly may act as a brake on this process, not a guarantee. A brake. And when it comes to Alzheimer's, any brake has a measurable value. Asthma is another area where ginger shows practical results. The airways of those who suffer from asthma attacks become inflamed and constricted. Gingerol acts as a natural anti-inflammatory in these airways, helping to dilate the bronchi and ease airflow. The most effective form in this case is the juice extracted from 5 to 7 centimeters of fresh root. The effect doesn't replace prescribed medication, but it can complement symptom management, especially in mild episodes. And migraines. Many people don't know it, but part of the intense headache that characterizes a migraine is linked to the dilation of blood vessels in sensitive areas of the brain. Gingerol acts as a vasoactive agent, meaning it influences how blood vessels behave. Studies indicate that consuming ginger, whether raw, dried, or as a supplement, can reduce the intensity of episodes and, in some cases, how frequently they occur. For those using specific migraine medications, this is a point worth discussing with a healthcare provider before making any routine changes. 9 benefits, 8 covered so far. The 9th, and perhaps the most important for those on long-term medications, I saved for last, not by accident, because it changes the way you should look at ginger. It's not just an ally. In some situations, it can be a serious problem, and that's exactly what I'm about to show you. Ginger is natural, but natural doesn't mean harmless for everyone. That distinction needs to be made clearly, especially for adults who already take some form of medication regularly. And that group is larger than it seems. The first warning is for those with gallstones. Ginger stimulates bile production, the fluid responsible for helping digest fats. In healthy people, that's beneficial. In people with gallstones, this stimulation can increase bile flow in a way that worsens symptoms and triggers painful episodes. If you have that history, avoid regular consumption without guidance. The second contraindication involves diabetes medications. Remember the study showing ginger improving insulin sensitivity? That effect can be positive, but it can also be dangerous when combined with medications that already do that work. The combination can lead to blood glucose dropping below safe levels, what's called hypoglycemia, dizziness, cold sweat, mental confusion. These are serious symptoms. If you take metformin or any other blood sugar control medication, talk to your doctor before making daily ginger a habit. The third interaction is with blood thinners. Medications like warfarin are used by people who need to prevent clot formation in cases of atrial fibrillation thrombosis or after cardiac surgery. Ginger has properties that also naturally thin the blood. When both act together, the risk of bleeding increases. This includes internal bleeding, which isn't visible, but can be serious. This is not a theoretical warning. It's a documented interaction that must be taken seriously. There's also a specific caution for those taking heart medications, especially those that regulate blood pressure. Ginger can potentiate the hypotensive effect of some of these drugs, leading to blood pressure drops that cause dizziness and fall risk. For adults over 60, a fall can have serious consequences. It's not a reason to eliminate ginger from your life. It's a reason not to make decisions without information. That said, for most healthy people or those with well-managed conditions, ginger can and should be part of the daily routine. The simplest form is daily tea made with fresh grated root. 1 teaspoon in a cup of hot water, 2 to 3 times a day, is enough to activate the effects we discussed. You can also add thin slices to rice, soups, or juices. Ginger powder has its place in supplements, but fresh root better preserves the active gingerol. Excess, on the other hand, takes its toll. Very high amounts beyond what would be reasonable in a normal diet can cause gastrointestinal discomfort, bloating, and diarrhea. The principle here is the same as anything worthwhile: consistency, not excess. A moderate amount every day produces far more results than an exaggerated dose once in a while. Ginger is not a standalone solution. It's a piece, a powerful piece with 4,000 years of history and increasingly robust science behind it, but still just one piece within a larger set that includes sleep, movement, varied nutrition, and regular medical follow-up. Those who understand this don't search for a miracle ingredient. They seek the consistent habit, and ginger, in that context, is one of the most well-documented ones that exist. Do you have gallstones, use a blood thinner, or take diabetes medication? Then this content was especially important for you today. Share in the comments whether you already use ginger and in what form. It helps others who are just getting started. If this video brought you something new, like it, share it with someone who needs to know this, subscribe to the channel, and hit the bell. Every notification is a reminder that taking care of your health starts with real information.